Hello, my name is Teresa and I am a dental assistant here at Ascot Family Dental in Roseville. I just wanted to go over some oral surgery post-operative care instructions. It is very important that you follow these instructions carefully. You will have general symptoms for the first 24 hours, which would include bleeding, swelling, discomfort, and nausea during and after the surgery. This is to be expected. After general anesthetic or intravenous sedation, a general feeling of drowsiness is normal. Recovery at home and sitting in the reclined position with pillows is best recommended. Care of the mouth. The gauze pack in your mouth should be resumed in your mouth for the first 30 minutes with biting pressure. After you leave the office, do not disturb the wound. Smoking or sucking through a straw can disturb the wound and should not be resumed for 3 days. Smoking can cause pain, irritation, infection, and bleeding. For patients getting wisdom teeth extracted, rinse with chlorhexidine rinse prior to bedtime for the first 7 days and resume to brushing your teeth after the first 24 hours to the best of your ability. A certain amount of bleeding is expected following the tooth extraction and surgery. It is normal to have oozing and pink saliva for a few days. You should not use more gauze unless you experience real bleeding. Real bleeding is a trickle of bright red blood that will not stop. If bleeding is excessive, check the cotton gauze is in the proper place in the area of the surgery. In the case of wisdom tooth extraction, the gauze should be placed as far as back as possible in the mouth. Talking and movement of your mouth and tongue will increase bleeding. Cotton gauze can be left in position while sleeping on the day of surgery, but should be removed at bedtime. Cotton gauze should be changed as needed and removed when bleeding is controlled. Discomfort or severe pain after difficult or prolonged surgery should be expected. Have your prescription filled and follow directions carefully. Never mix alcoholic beverages with medication. If you develop hives or a rash on any part of your body, discontinue all prescribed medications and immediately contact this office. Swelling normally increases for 3 to 4 days following surgery and then gradually decreases. Ice may be applied for 15 minutes and removed for 15 minutes, alternating on and off the day of the surgery. No need to continue applying ice after the first 24 hours. If you have teeth removed from the lower jaw, it's likely that your tongue, lower lip, and lower jaw will be very numb for 5 or more hours. Food should be liquid to pudding consistency. Check the temperature of any food items prior to eating to avoid accidental injury or burns. Occasionally, nausea and or vomiting may be experienced following oral surgery and anesthetic. Ordinarily, the feeling will subside within a few hours. During this nausea, the following suggestions are helpful. Bed rest, clear carbonated beverages, and stop all pain medications. Avoid all foods that require chewing for the first 24 hours. Ensure Jamba Juice, no straw, ice cream, yogurt, soups, broth only, and similar food is recommended. Remove gauze when eating or drinking and at bedtime. Consequences of missing teeth may include, but are not limited to, alteration in speech, shifting of adjacent teeth, collapse of bite, gum disease, aesthetically unacceptable looks, leading to social and psychological compromises. To prevent this, it is always recommended to replace the missing teeth. You have the following 2 options of replacement. Number 1 being a fixed option, implant or a bridge, and number 2 being the removal options, partial or full dentures. Make it a point to talk to the dentist about these options and the best that suits your needs. The wound should be checked in the dental office within 2 to 3 weeks. Please remember to make routine hygiene appointments, and again, feel free to contact us with any questions at 916-782-3129.